First of all, thank you very much. Thank you, Luis, for the invitation. I must say I have had the pleasure of starting at least 2 companies that had links to Nova. One had very strong links to Nova and is now at a very interesting stage of internationalization. I've worked with different institutes of Nova in the interface between science and economic values. So all the things that have been mentioned here and the theme of this conference are very dear to me. Today I will not talk about any project related to Nova, at least not for the moment. I will talk to you about a company I helped start a couple of years ago. I was the founding CEO and I'm still involved with, called Coimbra Genomics. And I think this is a good example, I hope it's a good example of not only innovation in health, but also of international expansion and partnerships, which is the theme, the topic that I was asked to talk about. So what I will do is I will describe the company and the technology, the business, the product it has developed relatively shortly. Then I will tell you a little bit about the history of the company, which I think may be interesting. And then I'll end by focusing specifically on the issue of international expansion and international partnerships. Okay, so first of all, Coimbra Genomics is a company operating in the field that's called personalized medicine or precision medicine or P4 medicine. There's a number of different names now, buzzwords. And to put us all on the same page, let me try to explain what this means, at least to me, to us. Personalized medicine is a model of medical practice where medical decisions, interventions, products, etc., are tailored to the individual, are tailored primarily to the individual patient, not to the population, not to a group, but to the individual. And of course, on the individual's response to disease, for example. So arguably, this is one of the major shifts in paradigm in healthcare in hundreds or thousands of years of Western medicine, if you think about it. And this is the space we're working on. When we talk about individual patient and doing something that's directed to the individual patient, we are talking, or maybe talking, I'll be talking about that patient's genomic or genetic constitution, the genes of the patient, and how they determine, for example, how that patient may or may not have a certain disease, may or may not respond to a drug. So that's what we could call genomic medicine. And a first question that is sort of basic but is interesting is whether this kind of medicine, this personalized medicine, is indeed possible today. And I will argue that it's possible in theory for a number of reasons. One is that, as many of you or all of you may know, the cost of sequencing a human genome has dropped and will continue to drop dramatically at a rate that's much steeper than Moore's law. And this graph is 2 years old already. Right now it costs, in certain circumstances, less than €1,000 to sequence a human genome. At the same time, as we all know, at least intuitively, the knowledge on how genes affect disease, affect health, has also been increasing dramatically. Every day we learn something new. And interestingly enough, most medical doctors, at least in industrialized countries, understand the importance of genetics for their practice. So personalized medicine should be possible. But the fact is that in everyday medical practice, it's not being used. If you go to a doctor today, in 99.5% of the occasions, your doctor will not be making decisions based on your genes, right? So this is not happening. Why is this not happening? Well, it's a complex question, a complex answer, but to simplify a little bit, today, access by a physician to their patient's genetic information happens through what I would consider now a difficult, expensive, inconvenient process. To put it simply, if a doctor wants to, let's say, look at your genes, to speak colloquially, because he or she thinks you might have a disease that may have a genetic basis, what happens? Well, the doctor will have to prescribe a certain genetic test directed at a certain number of genes, or a specific gene maybe that doctor believes is relevant. You'll have to take blood. there will be a genetic, there will be some kind of process, for example, DNA sequencing, genotyping, whatever. There's a complex report that's produced that's interpreted by a geneticist. Then the geneticist talks to your doctor, and a conclusion is taken. There may be variants, of course, to this process, but the point is it's complicated. It takes time. It involves several people. And worse than that, you have to do it every time. If, you know, in theory, a person had a number of diseases that triggered this process, this would have to happen every time. So this is a process that's not scalable. This makes personalized medicine adoption in everyday medical practice difficult, right? So, bottom line, personalized medicine is not practiced more widely because medical doctors simply cannot efficiently use genomic information without having to learn. In economic terms, without having to halt patient flow, which is a problem, it's a cost, social and financial. So, no matter how much progress there is in bioinformatics and genomics, bear in mind that what I described to you remains the same no matter how fast and cheap is the sequencing process, right? So, despite of this, there's a bottleneck in what we call the last mile to bring genomic information to the desktop of every medical doctor, right? So, as a consequence, the vision that belies what I'm going to tell you, the company we started a few years ago, Coimbra Genomics, is to shift the paradigm, to use a buzzword, in global healthcare, and I stress global, by turning medical decisions based on each patient's individual genome into part of routine medical practice, all right? So for this purpose, with this vision in mind, we have developed in the last year or two a software platform called ELSI. ELSI is a genome-based clinical decision support system. It's a system to support clinicians, physicians in their decisions, be it on prescription, diagnosis, prognosis, even screening, and any physician. This is not for geneticists. It's for any physician. So what I'll do now is I'll tell you a few features of ELSI so that you understand it. And I will not be very thorough. I'll give a relatively superficial view. Not just from the technical standpoint, but also from the business concept standpoint, which I think for this audience might be more interesting. So first of all, ELSI, this software platform, uncouples the act of sequencing genome, the act of obtaining genetic information, from a separate act, which is to obtain clinically relevant answers. With ELSI, you don't sequence your genome to necessarily answer or solve a problem you have at the moment. ELSI assumes people will sequence their genome for a number of reasons, even for no reason, just because of the potential it has overall. And then ELSI accesses that information at any point in time after you've sequenced your genome or exome or anything to obtain answers to questions that medical doctors ask. This is new. One thing is a non-medical act, which is obtaining genetic information. Another thing is the medical act of asking questions. ELSI works in this second part, assuming you've done the first. And this is actually a shift in the business perspective of this kind of product. And I can go deeper into that. It also has an implication. I will not tell you very much about business model per se, but it also implies that the way we make money, to put it simply, is on the questions. Genome sequencing is becoming a commodity. There's no money to make for new players there, we believe, or not a lot. Where the shift is, both in terms of practice, medical practice, in terms of economic return, is in putting value on the ability that doctors should have and will have with ELSI to get answers based on the genetic information that's generated through sequencing. And we do that through what we call queries. So what ELSI allows a doctor to do in a page like this, it's a bit outdated now, the graphics, but is the doctor can ask a question, a query. That query is essentially a name of a disease that the doctor may suspect the patient in front of him or her might have, or may know the patient has, or the name of a drug that the doctor may be considering to prescribe. So in this example that you see on the screen, the query is hemochromatosis. It's a disease. So the doctor writes hemochromatosis on that little square on the upper left-hand side and clicks search. This is after having permission from the patient. I'll come back to that. What happens when the doctor clicks search, and the word may not be search actually, is that Elsie will scan the patient's genome or exome, assuming for the moment it's been sequenced previously, for simplicity. It will scan the genome and will pull out all the genetic variants that are relevant, that have been proven by others, validated by others to be relevant for, in this case, hemochromatosis, but which are present specifically in that person's genome, right? And what the system does, and this is the clever part of the system, is that based on the information it collects, it generates a report which is written in human language. Actually, better than that, it's written in clinician language, because it was clinicians, physicians, that built this with us. This is not the product of software engineers or scientists. This is a product of physicians. So the report puts together this information in a clever way, in a report that can be generated literally in seconds. Right now it takes about 2 minutes, but it will be seconds. And the report has several features, but the most important one is this gray box you see there, which is where the information that's validated and relevant for the doctor's decision is put. It's what we call, and it's called in the field, actionable information. So this allows the doctor to very quickly make decisions that are based specifically on the patient's genome and specifically for the question, the query, or group of queries that he entered. In this case, hemochromatosis for Sarah Jensen, which is a fictional character, right? So there's a number of other things I could mention, but I can ask questions later on. I can answer questions later on. One thing I wanted to mention as a parenthesis is that the example I gave here is hemochromatosis, but right now, Elsie can do the same thing for a number of diseases or drugs, and this is outdated, I'm sorry about that, there's more now. But essentially, it can do this for any disease that has a genetic component that's been proven, or for any drug that produces a response that's conditioned genetically. So you may ask, how does the system put this report together so quickly? How can this happen so quickly? Well, it happens quickly because, essentially, we have built, and are building, constantly upgrading a database where for each disease or drug we're tackling, we've mapped all the genetic variants that someone else has proven were relevant for that disease or that drug. And so for each of those variants, there is an answer. So when you click hemochromatosis, the system has a number of possible variants related to hemochromatosis, and associated with that variant is some kind of clinical significance. And where the system is clever is in putting them together in a way that also takes into account the interactions between them, and therefore a report is generated. So the answers are there already. What the system does is put them together specifically for that patient in a clever way. That's why it can be done in seconds or minutes. This is new. There's nothing, to my knowledge, that does this anywhere. So each element is there before the question is asked. Another important feature is that this is, we believe, ultra secure. We worked with Critical Software, which is one of our shareholders, in building a system in a way that's really bulletproof. Essentially, there's no way in which anyone, including, of course, us, the company, can make a connection between a patient's ID and his or her genetic makeup, his genome. The only way that connection can be made is in the presence of the patient and the doctor, each of whom have a key, a specific personal key, and with the two keys together, and the key can be, for example, a USB key, but can be other things as well. In the presence of those two keys, the doctor can ask questions about that person's genome and make the connection between the ID and the genome. But even then, all the doctor can do is ask questions about specific diseases, specific drugs. So not even the doctor can look at the person's genome. The doctor can ask specific questions to the person's genome with that person's specific permission. So it's very secure. There's a few variants here that I won't go into. Another important feature is that ELSI can connect to other systems very easily. You all know medical doctors are a very conservative group, especially in terms of technological adoption. What we didn't want to do is create a system that would be a burden for doctors that already have to use, for example, a certain hospital's IT system. So what ELSI is, or what ELSI can be, is everything I showed you here can be a button in another system. For example, it can integrate very well with existing electronic health records systems. So it doesn't burden the doctor. The doctor doesn't really have to learn anything. And by the way, the doctor doesn't have to know anything about genetics to use ELSI, which is one of the main shifts in paradigm here too. So this also means that we are not competing with a number of other players that do, for example, classical genetic testing or that develop hospital IT systems, because we can be simply an improvement of their existing systems. A major improvement, but an improvement. So we are an added value to a number of players, and there are many big players in this field in the world, and we're talking to many of them and working with some of them. So these were some of the key features of ELSI. A few others are here. I won't go into very much detail. This is a web-based system. It's completely agnostic as to, for example, what technology someone used to sequence their genome. It works with whole genome, exome for those of you who are more in this area. It works with genotyping. It works with anything. It's very flexible as to the legal and ethical requirements of each country, each region. For example, we can have informed consents put in different parts of the system in different ways. So it can adapt very easily to any country, which relates to what I'm going to tell you next. It also articulates with geneticists and genetic counselors. It doesn't aim to replace geneticists. On the contrary, it aims to make their work much more interesting. So, very shortly, company history. So the company was founded about 2.5 years ago, actually a bit more than that now. And at first, it had a number of projects it was, and still is, tackling, not necessarily what is now ELSI. Our first big alliance was with a Chinese conglomerate called BGI, which is a powerhouse in genomics in the world. We had a project with them of about €1 million in stomach cancer, also with Ipatimub, which was it is a very good partner for us. Speaking of university company interactions in Portugal. We were founded by a group of entrepreneurs with Critical Software and the Biocant Park, both in the center of Portugal. And we were funded later by both public and private venture capital. We gained a number of, we won or were granted a number of grants. We first started working with hospitals in the University of Coimbra, SHUC, where a number of doctors helped us develop the system for doctors, for medical doctors, in what later became ELSI, as I described it to you. In 2015, ELSI was developed, basically. It took about 1.5 years. And it won several prizes. It was considered one of the top 3 promises in all of e-health in Europe from among more than 100 contestants, and also got a few prizes from well-known sources. And this year, we had our first patients in Germany. And I will tell you a bit about that in a second. So this is a very brief history of the company. As I said in the beginning, I was challenged to come here and focus on the topic of internationalization, partnerships, expansion. So I want to focus a little bit in the last part of my talk on how a company like Coimbra Genomics, a startup in Portugal, thinks and acts on international expansion. And let me tell you first that, as I hope you all imagine, for a company like Coimbra Genomics, internationalization is not an option. It's a given. You are developing a product that it's innovative anywhere in the world. It wouldn't make, it would be pointless to develop ELSI for Portugal or for any country. So the company has to be born global. All these companies have to be, or should be, in my opinion, born global. So it's not an option, it's just something you have to do. We're in Portugal as we could be anywhere else. So But on the other hand, how is this done? How is this implemented? How do you deploy a product like ELSI globally? A product like ELSI, just like any IT product, which is what this is, needs to gain traction, needs to have people using it, needs to gain credibility, needs to gain awareness at a global scale. But how do you do this when you have what we have, which is, we believe, a paradigm-shifting product, a product that is different from what people are used to? It implies that people, physicians, have to change their way of working, essentially. It's geared towards a very conservative group. This is not for tech geeks, this is for medical doctors. And it's launched by a small startup in Southern Europe. So how do you go about it? We didn't have the channels to suddenly start distributing this all around the world. We didn't have the money to pay 100 hospitals to use the system, or physicians, right? We are not coming with a seal of, you know, Harvard or something like that, although we try to have some of those seals as much as we can. So how do you do this? The strategy we chose was the following. It's simple. We were targeted. We decided to go select a small, relatively small number of very good healthcare institutions, very good clinics and hospitals around the world in different regions, different cultural contexts, and have their top doctors use ELSI. More than that, have their top doctors feel they are co-authors of ELSI, feel they are developing ELSI with us because they are adapting it to their local contexts. Gain their trust, gain credibility through their credibility. We call this the Trojan horse strategy because we enter, it's free, you know, we just give the system to them, work with them so that they like it, they feel used to it. And then from those institutions and from the hands of those top doctors, so-called key opinion leaders, KOLs, we then spread to the hospital, the clinic, the region, the country, eventually the world. So that was quite simply the strategy. We want to demonstrate international KOL acceptance, adoption, and of course, in the process, generate the first permanent revenue streams and use those hospitals as starting points for global expansion. So let me elaborate a little bit on that just to give you concrete examples of what we did. And happy to hear now or later your comments and criticisms. We are now either implementing or planning a presence in different parts of the world, as you can see in that map. We started with an alliance with a hospital in Germany called the Preventicum Institute for Personalized Medicine, or for Individualized Medicine. Why? This is a very small clinic, but is completely top of the line. What it does, basically, is checkups, yearly checkups for high net worth individuals who are Germans, but also mostly Russians, Arabs, etc. What this means is not only that they're very advanced, and the president of Preventicum is a top cardiologist, but very simply that their patients do not have a problem in paying for what is the major hurdle for the adoption of our system, which is sequencing their genome, which still costs 1,000, 1,500 euros. So a person that goes to this hospital, Preventicum, and pays 10,000 euros a year for a checkup, which is what they do, 5 to 10,000, will not blink at paying another 1,300 to sequence their genome once, and then every year, with much lower amounts, having their doctors ask questions through ELSI. So this was a very simple strategy. Have high net worth people at a very credible top-of-the-line institution that everybody wishes they could afford, use ELSI. And the good news is that it went very well, and this is a place where we have our first clients and where we'll have our first paying clients very shortly. A second approach, also in Germany, and Germany is important for reasons that I don't have time to elaborate on, was a larger clinic in Germany, also very well known. It's a clinic that aims to be the center of e-health, the center of excellence for e-health in Germany. So this is a much broader scale now, many more patients. And this is also the site where the company will have their future office. It's not formalized yet, but we'll have a presence there, which you may imagine is also relevant for a number of other reasons. Having an office in a place like this, we need to be close to patients, and it looks good to be in Germany. Another very interesting example is the German hospital of São Paulo in Brazil. This is one of the top 3 hospitals in South America, widely considered. They want to be more innovative than their counterparts. We were lucky enough to have access to their leadership. We're welcomed, the doctors liked it. We're working with about 15 doctors there of all specialties and with the administration of the hospital. And there's now a plan for a joint effort between Coimbra and the German hospitals to expand through South America under a common brand name. So essentially this is a vehicle to expand into a very interesting market where, for instance, just to give you an example, American players that can be seen as our competitors don't have any foothold on. So we're very enthusiastic about this. Another example I mentioned before, CHUC here in Portugal, was the first hospital we worked with. They agreed to be beta testers of LC. They are the largest public hospital in Portugal, ranked #1 at least a couple of years ago. And we have a very old, strong relationship with them. Another very interesting example is the country of Estonia. I don't know if anybody is familiar with this, but Estonia is probably the most advanced country in the world in this general field, at least parts of the field of e-health and personalized medicine. When President Obama announced his big bill to foster precision medicine, which involves billions, he mentioned Estonia as the example the United States should follow. There's a number of reasons for this. Just to give you a couple of examples, Estonia has a homogeneous universal electronic health record system. Estonia has passed a law last year that allows reimbursement by the state of whole genome sequencing of newborns, everyone that's born, which is the way the world is going to go. It's the world we want as a company, and this is the country that's doing it. What's interesting about Estonia for us is that we're not working with a hospital, we're working with the government in an initiative called the Estonian Personalized Medicine Initiative. So the end game for the company here, quite simply, is to have LC deployed in a whole country, to be the system of the country. And we are one of 3 companies with complementary products working with the Estonian government. Another example in Israel, top hospital, the Rambam, associated with the Technion in Haifa. We see this, among other things, as a possible test bed for an expansion into the US due to the connections between the financial and medical communities of Israel to the US. And lastly, our most recent formal partnership, we are working in Finland with a company called Duodecim, which is the commercial arm of the Professional Association of Medical Doctors in Finland. And they have a clinical decision support system that is used by 90% of all the doctors in the country. So what we're doing, quite simply, is plug LC into that system. And in one strike, of course this is still early stage, we're developing a couple of pilots in the next few months. The potential is to have 90% of the doctors of Finland use LC. So this was to illustrate international expansion. In each of these units, we go and talk to the key people, the key doctors, and also with the legal experts of each country. And this has been the strategy of a small company, and hopefully we'll expand and have tens of such partnerships around the world. I'd like to just end by showing you our team, also to illustrate how small it is. It's a largely virtual company. We have a team of very talented people. I will just mention the first person there, Bruno, was the first person I recruited for the company, was my employee #1. And I'm very proud to say that he's now, since last year, the CEO of the company and doing a great job. He was trained in the UK, postdoc in Cambridge, was CSO of a genomics company there. All of these people, the ones who are Portuguese, were, interestingly enough, all trained abroad. But the company is becoming internationalized, and therefore we have now people who will become, or are becoming board members, etc., that are no longer Portuguese and are top of their game in countries like the UK and the Nordics. So in addition, we're working with now not 20, but now close to 50 medical doctors around the world. And well, I hope this is an interesting example of all the things that were spoken in the introduction in a more general way for the country and I guess for the world and for innovation in health. So thank you very much.